Hello, friends! I'm Jamie Swartz, a lifestyle medicine physician, certified personal trainer, and yoga teacher. Today, we'll be talking about the physiology of cardiovascular disease in women and yoga's healing potential. What if your heart, that tireless guardian that's pumping life through every artery and vein, suddenly faced a silent siege, one that strikes women differently, often with whispers of fatigue or dizziness instead of a thunderous pain? For millions of women, cardiovascular disease isn't just a statistic. It's a stealthy intruder reshaping daily life. Today, we'll uncover the physiology of cardiovascular disease in women, what's happening scientifically in our body, and how yoga, grounded in evidence-based research, can help restore rhythm and reduce symptoms. We'll interlace faith-centered encouragement, drawing on God's promises of strength in vulnerability. And we'll include key precautions for beginning yoga safely. Let's journey together with clarity, compassion, and hope. First, let's illuminate the physiology of cardiovascular disease in women with accessible science. Cardiovascular disease includes conditions like heart attacks, strokes, and heart failure. But in females, it often manifests uniquely due to biological differences. Estrogen plays a protective role pre-menopause, supporting our vessel flexibility and reducing plaque buildup. But post-menopause, estrogen's decline heightens our risks, leading to higher lifetime cardiovascular disease odds, nearly 1 in 2 women. Women tend to develop more microvascular disease, where tiny arteries malfunction, causing diffuse symptoms like unusual fatigue, dizziness, or clammy skin, rather than the classic chest pain we might associate with a heart attack. Some risk factors overlap with men: hypertension, which is high blood pressure, diabetes, and smoking. But women face unique risk factors, including pregnancy complications like preeclampsia, autoimmune diseases that are more prevalent in females, and hormonal shifts. At the cellular level, inflammation drives atherosclerosis, which is plaque accumulation in our arteries, narrowing our blood vessels and risking clots or ruptures. The heart muscle may weaken from sustained stress, leading to heart failure, while irregular rhythms like atrial fibrillation increase stroke risk. It can be complex to understand, but knowledge empowers prevention and management. In our vulnerability, God offers us profound comfort. As Psalm 73:26 declares, "My flesh and my heart may fail, but God is the strength of my heart and my portion forever." God sees the hidden battles in our vessels. He invites us to trust His sustaining power, turning our weakness into a testimony of His grace. So, you may be asking, how can yoga, a harmonious blend of breath, poses, and mindfulness, help counter this cardiac storm? Research shows gentle yoga can be a safe, effective complement, particularly for women. Evidence abounds. A 2019 American Heart Association review found yoga lowers cardiovascular risk factors like blood pressure and cholesterol, with benefits comparable to aerobic exercise. Can you believe it? A 2022 meta-analysis confirmed yoga's role in improving lipid profiles, blood pressure, and psychosocial outcomes in cardiac patients, reducing morbidity. For women specifically, a study on early postmenopausal participants showed 3 months of yoga enhanced heart rate variability, which is an indicator of heart health, and decreased cardiovascular disease risk. Recent 2025 research, including a May 2025 review, affirmed yoga's impact on heart health markers, reducing sympathetic stress, that fight or flight mode, and inflammation. A 2024 study on heart failure patients noted that yoga strengthens the heart and boosts activity levels. Why? Well, yoga modulates our autonomic nervous system, decreasing cortisol and sympathetic overdrive while fostering resilience. Basically, it helps us calm down and deal with our stress and anxiety that may be stimulating us. From a faith lens, yoga can be prayer embodied. In a gentle restorative position, we can be embracing Isaiah 40:31. We who hope in the Lord will renew our strength. This is not just for symptom relief. This is an opportunity to rest and be still in God's presence as we surrender our heart to the one who holds all of us. Precautions are crucial for safety with cardiovascular disease. Ensure that you consult your doctor before starting, especially if you have arrhythmias or recent surgery. You may want to avoid hot yoga, as high temperatures can strain the heart and contribute to dehydration. You may also want to skip inversions if you have hypertension or glaucoma. Begin slowly with gentle styles like restorative or chair yoga. I encourage and invite you to use props like chairs, walls, blankets, blocks, or bolsters for support and comfort. Stop if you feel dizzy, irregular heartbeats, or chest pain. We can close by picturing our heart's fiercest storm when every beat echoes fear and stress. Now, let's visualize ourselves in a supported child's posture or your favorite restorative form with our breath steady, whispering, God is my strength. This defies the chaos. Science shows how yoga can help us restore our rhythm. The Bible shows us how the great physician heals. Let's keep breathing gently and building our resilience together. Our stories ultimately end in triumph. Thank you so much for joining me today. I hope to see you again soon. May God's generous love and peace pulse through you today.